Kristen Redenbaugh. Good morning, Kristen.
Good morning.
Kristen, let's talk about cervical cancer. Explain to us exactly what it is and how common is it?
That's a great question. Thanks for having me on and allowing me to talk about this.
Of course.
Cervical cancer happens when abnormal cells grow on the cervix. The cervix is the opening to the uterus or the womb where the baby grows. The main cause is going to be HPV, which is the human papillomavirus. The virus is super common, and a lot of people don't even know that they have it. Globally, what we see is cervical cancer is the fourth most common cancer in women. And here's the good news. In places like the U.S., where we have regular screenings like pap smears and HPV tests and the HPV vaccine, the numbers of women with cervical cancer have really dropped over the past 10 years. And if it's caught early enough, it can be cured.
Dr. Redenbaugh, what are the recommended guidelines for cervical cancer screening? And when should women start getting screened?
So the general guideline is for women to start screening at age 21. From 21 to 29, we typically do a pap smear every 3 years. And then from age 30 to 65, we switch to a pap smear with an HPV screen every 3 to 5 years. After age 65, if you've had a normal history, you can speak with your doctor about whether you want to continue screening or not. Everyone's situation is a little bit different. I think the important thing is to go in, see your doctor, and talk about what kind of screening regimen is right for you.
Got it. Are there any early warning signs or symptoms of cervical cancer that people should be aware of?
You know, when it comes to cervical cancer, it can be tough because there aren't obvious signs, especially in the early stages, which is why it's really important to get in and get screened. If it does show up, it tends to be a little bit more advanced and might show up with things like unusual bleeding. Some women might have some pelvic pain. Another thing to watch for is abnormal discharge that's watery or bloody. Most of the time, if those things are going on, it is not cervical cancer, but it's really important to go in and see your doctor and get screened. And Maui Health has an awesome online resource called mauihealth.org/cervical cancer if you want to find out more about this.
Awesome. Dr. Kristen Redenbaugh, Maui Section Chief of Obstetrics and Gynecology at Kaiser Permanente Hawaii. Dr. Kristen, thank you for joining us this morning. We'll talk again, okay?
Right on. Have a great day.
Awesome. Aloha.